Jack Church, welcome to my podcast.
Cool. Pleasure to be here.
And this is your very first podcast experience.
Yeah. Haven't done anything like this, so I'm excited.
I think it was I hadn't even heard of you, and someone, I think it was your sister-in-law, messaged me on Instagram saying you should get Jack on.
Yeah, she did that, threw me under the bus, or maybe gave you the best opportunity ever, so we'll see how it goes.
Well, you never know. But I feel like from what I've learned about you and researching for this podcast, you're a guy that says yes more than no.
Yeah, definitely. I'm always keen to say yes, and that was before the time that changed my life, but even afterwards, still keen to say yes.
Yeah, so we're going to, there's so much to the Jack Church story, and we're going to unpack all of it. First of all, paint a picture of Jack Church before 2021. Who was that guy?
That guy was sporty, athletic, pretty much into health and fitness as a PT in the Navy, so physical trainer in the Navy. And yeah, he was just all about fitness and just coaching other people, getting other people to achieve their goals, getting people fit to serve in the Navy, and yeah, just loving life really.
So you're a savage. So you're like as fit as what anyone could be, like in the sort of top 2%, top 5%.
I'd like to think so. Yeah, I was pretty fit. I was lucky to obviously be working in a gym, so I had the opportunities to keep fit, keep health, keep nice and healthy. And yeah, I was pretty fit.
So that was 2021, and then that was the year that your life turned upside down. So you're 26 years old.
Yeah, correct.
And what happens? What are the symptoms?
So the first symptom that I thought that I can remember was just like general fatigue, like sleeping, like naps during the day and stuff, which is not really normal for me. I'd be able to wake up, go to work, and be fine for right through to the night time. So that was sort of the first symptom, and then eventually. I just got more and more fatigue. There was no pain though. There was no pain. It was just fatigue, like just almost like the hungover feeling, like feeling hungover, just drained. Sort of that was the vibe that I sort of got, and that was the sort of first symptom that I noticed about me.
And no amount of blue Powerade was fixing it?
No amount of blue Powerade, no amount of water, no amount of any tricks or anything, nothing.
So what do you think? Because you're quite in tune with your body. Are you aware that something's wrong, or you think you're just getting older? What do you think it is?
Yeah, I thought I was overtraining. So I thought, okay, maybe I'm pushing my body too far. Maybe I need to dial back and just add some recovery and rest more, and then allow my body to heal. So I did do that, dropped back the training. And nothing changed. So I was like, okay, that's weird. And then I started to think, well, what could it be? And then I started to have trouble breathing. So that was the next symptom that sort of came on, like sort of shallow breaths, having to try and really focus on my breathing rather than just letting it happen naturally. So that was another symptom that sort of, I guess, started to trigger alarms for me. And then eventually I remember like starting to walk upstairs and having to stop at the top. And that was like, I was like, oh, okay, no, something's definitely not right. Normally I could walk up a set of stairs and be fine, but I couldn't even get to the top without having a stop sort of thing.
Yeah, and at what point did you seek some medical intervention?
That was about then.
You waited until you could barely climb the stairs?
Yeah, so I waited.
How long? What sort of time span are we talking?
Oh, maybe, it's hard to think, but I'd probably say around Feb that I had early symptoms, then around, would have been like April that I finally went.
So like 2 months, 10 weeks perhaps?
Yeah,
Oh,
probably.
bro.
Yeah, I've just...
Are you embarrassed now? Like you should have gone sooner?
Yeah, definitely. When I look back on it, I'm just like, why did I wait so long?
But if you went at the earliest possible convenience, would it have made any difference?
I don't know, hard to tell to see at what stage my heart was at and just where it was. But yeah, I don't know. It would have been interesting to see if I did go to that early stage, what the rest of the journey would have been like and how it would have paid out.
Because us men in New Zealand, we're notoriously bad for this.
Oh, notoriously bad. And I'm example number one. Yeah, so that's definitely been a learning curve.
Yeah. If you're a PT and it gets to the point after a couple of months where you're napping through the day and you're struggling to walk up the stairs, bro.
There's some alarms going.
So, okay, so you eventually get medical intervention, and then how long is it before they figure out what's wrong with you?
So I go to the doctors. I came with the symptoms of struggling to breathe. So they initially thought it might be my lungs. So they gave me an inhaler just to see if that could help open my airways and come back in a week and see if nothing's changed. And nothing did change. So then I went back. We got another X-ray, and that's when they found out. That's when they seen like the size of my heart was pretty much normally obviously the size of your fist, but it was about this big. So it was coming across my sternum, and that's when they sent me to North Shore Hospital, and that was 24th, I think, of May, or 24th of May. Yeah, I think I got admitted into North Shore Hospital.
What was that like? Was that scary? Like confusing?
Confusing. I'd say confusing, yeah, not scary. Once I seen the X-rays, they were like, hey, just pop in to the North Shore Hospital. They'll be able to do some more checks, some more diagnosis, and then we'll be able to figure out what the plan is from here. So I just bought an overnight bag sort of thing, thinking we'll just see what's going on, really. So I didn't really have any fear or anything, just confusion of, okay, maybe we'll find out the cause now. And yeah.
So they do some tests and things, and then when do they figure out what's wrong?
Yeah, so they ran some tests. I remember being asleep in the North Shore Hospital, and my flatmate was there, and she could see like my chest, my heart beating in my chest, and I think my heart rate was 120 beats per minute, and I was asleep.
What would your resting heart rate normally be?
42.
Right. Wow.
Yeah, so it was nearly triple.
So we were talking just before. Like I did this mountain run over the weekend, the Kepler Challenge,
Yeah.
and I think at one point on the uphill, I was looking at my watch, and it was like 120 beats a minute.
Yeah. So while you're going uphill, I was just sleeping. So it's crazy what the body can do. But yeah, so once that happened, run through some tests, and then they said, hey, this is a bit bigger than what we can chew. We're going to send you to Auckland Hospital. And that was on the 26th of May. So 2 days later, I was off to Auckland. And I think that's when I sort of knew, okay, like if North Shore can't deal with it and I'm going to Auckland, this was going to be, I don't know, bigger than what I thought. But I still was confused of what was going on. I didn't really have an actual diagnosis then. So it was all just more tests and more X-rays and all that sort of stuff.
How long did it take to figure out what the problem was?
Around about a month.
So you're in hospital the whole time?
Yeah.
Oh.
Yeah. So I was in hospital.
And in a ward with old dudes?
Yeah. yeah. I was looking around going, I think I'm definitely the youngest by far here. We sort of felt out of place. I was like, I don't know if I'm meant to be in here, but yeah, that was about I'd say a month of just tests like inotropes, doing this, medication, all these sort of X-rays, IVs going up, testing the heart, everything. And it was about, June, end of June, where they made the deed. They came in and said, I think you're going to need a transplant. And I was like, oh, okay. I think the first feeling that I had was relief, just because finally found the issue or like the problem and that there is a solution to the problem. So that was my first feeling of more relief than anything.
So what did you know about like organ transplantation and in particular heart donation at that point? I'm guessing fuck all.
Yeah, absolutely nothing.
So it's just not something you hear about.
Nah.
I think the year you got it done, there were 14 heart transplants in New Zealand. It's like that rare.
Yeah, it's crazy.
So when you get told that, is the room spinning? Like what are you?
No, yeah. Like when I get told it, I think, it's a small relief. Like I was like, finally, because obviously I'd been in hospital for a month and previous to all of this, I'd been active. So I'm going stir crazy in there, not being able to do anything, not be able to be myself and not be able to get outside. So when they finally found the problem, I was like, okay, there's going to be a solution here and then I can get back on the road. So that's instantly where my mind went, was straight to the solution. All right, now we can start. It felt like we could move forward now. Whereas in that whole month during hospital, it was just going like this. Like every night I was just like, what's tomorrow going to look like?
Geez, you've got such a good mindset, eh? Where does this come from? You just or you just wired this way? Is this how you were raised?
Yeah.
Is this learned?
I think I just grew up around a good environment, around good people. It's hard to pinpoint where it came from. I don't know if the military had something to do with it as well, just always trying to find the solution rather than dwell on a problem. Like because obviously that in a military sort of sense, you're looking at trouble straight away. So you always got to be looking for a solution. I think that sort of just, those skills sort of just transferred across into this sort of situation. And the skills that I didn't know I had until I got put into that situation. So,
What's the solution if you sink an $80 million boat in some ice?
you try and find another one.
You get on Trade Me Marketplace.
Yeah, see how you
see
go.
what's going. Okay, so you get told you need a heart transplant. Then do you start just Googling furiously yourself, or do they give you like a bunch of scenarios? Like, do they tell you what the success failure rate is? And
yeah, so the nurses and doctors are really good. Laid everything out. Previously, you know, I've always learned about never Google what your symptoms are.
it's always kids.
Yeah, it's always kids. It's always just death straight away. So I'm just like, okay, we'll just stay off Google. That'll be the best thing. But yeah, I think the nurses pretty much laid everything out. In my head, when I got told transplant, I was like, well, I'm not the first. So, and it's like, what was it, 2021 then? Surely we've got a good system in place where the success rate should be high. Obviously, there's risk with any surgery, no matter how big or how small. So I just tried to dwell on that positive side, like, well, I'm not the first, like, and I won't be the last. I had faith in the doctors and trust that we'll be back out on the road. And for some reason, I just knew it wasn't my time to. I was like, it's not my time.
By the way, I really love that saying you just used, like, dwell on the positive. Like, I've never heard that saying before, but it's such a good way of framing things.
Yeah.
Dwelling generally is only associated with like negative outcomes, isn't it?
Yeah. Most people, do associate that with negative.
100%. Okay, and then so you're good with it. Then you tell your parents. Have you got a partner?
No, don't have a partner, but
you've got like parents or siblings or people that love you. What's their reaction like when you tell them?
Yeah, theirs was, I guess probably worse than mine.
Yeah, was that when it sort of crystallises it for you, just what a big deal this is?
Yeah, I think so. I remember sending a message to my flatmate saying, hey, I've got to just check into hospital, check my heart, and sent that to mum and dad as well. And yeah, instantly they obviously pressed the panic button. But yeah, that's when, because parents live down in Nelson, so they were coming up. But yeah, I think they were more worried than I was. I guess that's pretty fair. But yeah, I was too busy trying to get back on the road. To worry about anything else.
So what are some of the bullet points they give you? Like the chance of success, how long the heart lasts, what the outcomes are afterwards, what you can and can't do?
Yeah, I can't remember the actual percentage of success, but they did say on average a heart lasts 16 years, and that's give and take, like it's a ballpark figure. Obviously, there's so many factors involved, whether how you treat it with what you like with your medications, what your lifestyle's like. So there's obviously so much variance to that sort of ballpark figure. I've met people that have got 25 years and they're still ticking away. So it's quite cool to meet those people and realise that 16 years, when I heard 16 years, I was like, that's not long. That seems quite quick. And then I'll be back under again. But yeah, when I met people at 25, I was like, okay, now we'll be able to keep going with this ticker. My lifestyle is I'd like to say it's pretty good in order to stretch that ballpark figure out.
And in terms of like rigorous exercise and things afterwards, do they encourage you to be active, or are you discouraged from pushing it?
Yeah, so I was one of the first to undergo the study in hospital from the physios, where they just introduced moving as soon as possible after transplant. So when I was in the ICU bed, like I had to get minutes. I think I had to tally out 45 minutes a day, but that could be anything from squeezing a ball, and I'd start the clock, moving my feet, pressing against the bed, any movement, and they're trying to get, I guess, this movement as soon as possible and see if that the outcome of that's better, rather than letting the body just sit and rest. So that from there again was another mental win for me, because being an active person, and they're like, I need you to hit 45 minutes a day. So that was my focus every day in ICU. I was like, I've got to get my 45 minutes. And because it wasn't lifting a barbell or running up a hill, it was just could be squeezing a ball. So I was like, definitely achievable. And obviously I had all the time in the world at that point. I was just sitting in bed doing nothing.
Just yarning with old mates.
Yeah, exactly. So I was like, surely I can achieve 45 minutes. And then eventually, when I was healed, the heart rate needed to stay down. Like I couldn't go straight back. My history of training is CrossFit, so I couldn't go straight back to CrossFit because it was too intense. So I just had to monitor, I guess, my symptoms and just gradually build that fitness back up and be patient, which is not my forte at all.
Oh, we've only been going about 15 minutes, but yeah, you're painting a very clear picture.
Yeah.
Oh, just what an impatient fella you are. Okay, so you're just backing up a little bit. So September 2021, that's when you went on a wait list for a heart transplant. And what do they tell you at that point? Because it's not a case of having like a storeroom or a freezer with a bunch of hearts and they just grab one, right?
Yeah, correct. So what they tell you is we're going to put you on the active waiting list, and that just means your body's good to go, and then you got to wait for a heart, and that could be 1 hour to 2 years. You don't know, right? The bad part about this is that you have to wait for someone else's misfortune for your fortune. So that was the hard pill to swallow.
So in terms of compatibility, what is it? Is it the same blood type?
So same blood type, same size, or like relatively the size. So if you got like a 120 kg male, big ticker, you can't really put that into a 60 kg male because it just won't physically fit. So they've got to, based on that. And gender doesn't actually matter, which I found quite surprising. So you could get a woman's heart and a woman could get a male's heart.
Imagine that if you suddenly became all emotional and you're like, why am I crying at rom-coms?
Yeah, exactly.
Well, I didn't think Wicked the musical would be so sad.
Yeah. So personally, I was not keen for a woman's heart. Nothing against women, but I was like, that's interesting. Found that quite interesting, but yeah.
It's fascinating. So age doesn't matter. So they're not looking for someone. Are they looking for a young heart for you?
Ideally, age has a little factor, but at the end of the day, like if the shoe fits, no matter what the age was. Yeah.
So how long was it before, after being told that, heart... Oh, by the way, what would have happened if, the alternative, say it's a heart transplant, or was there medication they could have put you on or anything they could have done with your original heart?
So that's what they tried to do. So they tried to do medication, they tried to do the inotropes, tried to bring it back down to a normal size. Like, because it was so big, it was working overtime. I tried to bring that heart back down to a normal size, slow the heart rate down, but just nothing was working. And a heart ejection fraction normally is 60%, so you get pretty much pump the blood around 60%. Mine was down to 5%, so it was pretty much knocking on the door, really. So they had to bridge the gap to transplant, so they put me on this thing called a BIVAD. So it's another open heart surgery. BIVAD, VAD stands for ventricular assistance device. So it's just a pump in the left ventricle and in the right ventricle, and that now pumps my heart for me. So I had these two sort of cords coming out my stomach, these bags, these like man bag sort of things, batteries, and they were pumping my heart in order to bridge that gap to transplant, because they don't know if I would have made it. So if they just left me there, it's like a ticking time bomb, really. So they put these in, and then the VADs, you can stay on the VADs system for pretty much life, really. So it's just I know America do put patients on for life, whereas New Zealand, we use it as a bridge to transplant. So it's not a forever thing. So
how long were you going around carrying?
Yeah, so that was July the 11th or 16th, I think it was, that I had that surgery. And then October 4th was when I had the transplant. So yeah, a couple months, but those...
So you're at home, or you?
Yeah. So this was during that big lockdown in Auckland. So if there was ever a time to do it, it was that time, because the rest of the world was still as well. So I didn't actually have too much
to do.
Yeah, to do, and neither did anyone else out there in the world.
That sounds really inconvenient. Doesn't sound like a long-term solution, carrying around.
Yeah, they were pricks of a thing.
Right.
But they made me feel better than what I did not having them. So I was thankful for that. But yeah, they were very annoying. Like a shower, just to have a shower, transfer them into like a wet bag sort of thing, like a dry bag, sorry. Like put patches on it so the cords wouldn't get wet. The whole shower would take about just an hour just to get everything sorted. So I had to sleep with them, plug them in at night. So like almost like hook myself up to the main power. So I'd be sleeping on my back with the bags right there. So yeah, all that sort of stuff was good because it made me feel a little better, but it was a pain in the ass as well.
How did you stay positive? Did you stay positive? Because you're not sure how long. You're not sure if this is going to be your new normal or how long this is going to be.
Yeah, exactly.
Did you get down in the dumps?
Yeah, definitely. In that stage, that was probably my biggest down in the dump stage with these bags. They were just. I was trying to stay positive that it made me feel good, but they were just honestly like so annoying. It was hard to eat, shower, everything that I'd normally do was just a pain in the ass, really. So yeah, that would probably be my darkest time, and definitely went deep into that dark time too. Because as soon as the pretty much unhook the power, like that's it, your heart will pretty much stop. So there was times where I was like not ready to pull the cord, but had the thoughts of just pulling the cord, and then I just had to pull myself out of that sort of mindset and realize that it isn't forever. Like this is just a bridge. Like it's only a bridge, like you'll get past this. And that's pretty much where I had to keep looking. Once I dived into those deep dark spots, I was like, have to look forward.
Oh, thanks for sharing that. Are you good at talking to people about the stuff, or you just sort of work it out on your own?
Yeah, definitely classic male. Work it out on my own. Never really told people that I went to those sort of spots. I mean, some people still don't know now.
Hi guys, welcome to the podcast.
Yeah, now they do.
Jack's sorry, in future he'll talk to you about these things.
Yeah, definitely. Yeah, I think my old man was the first one to ask me, actually.
Yeah, what did he say?
He asked the hard question. He's like, hey, this is going to be a tough question to ask, but did you have like suicidal thoughts during your journey? And it caught me off guard. Us males, we don't really talk about that or ask those questions, but I was quite proud of my old man for actually hitting me up and asking that question, and I was relieved to get it off my chest to say, yeah, I did. I definitely had those thoughts, but it was only for a very short amount of time, and then I just had to push through it. But yeah, I was proud of him for asking.
Yeah, it probably took a lot of courage for him to ask, but I'm proud of you for telling him as well, because you could have easily just been like, sweet.
Yeah, which is what pretty much I still do now, really.
Yeah, I saw a therapist a while ago, and she asked me at the time, like she said, have you ever had suicidal thoughts? And I felt really embarrassed about saying, but I'm like, yeah, from time to time. Yeah. And she made me feel really good. She just sort of shrugged her shoulders and she goes, well, that's fairly normal. She goes, and there's a big difference between having those thoughts and actually coming up with an action plan.
Yeah.
We were on her fourth floor office at the time, and she's like, I mean, you or I could just go out there and jump off the balcony now and I'd be over and done within 5 seconds. Yeah. So it made me feel, it was actually like a relief off my shoulders, because I thought, having these thoughts in itself is not abnormal.
Yeah.
It's just, I suppose, a worrying thing if you get further down and you start to like implement a plan.
Yeah. So I didn't try to shrug off the thought. I was like, sort of acknowledged it. I was like, okay, we have gone into this dark spot. But yeah, let's try and not go further. Let's just look forward now.
It's unnerving the way, like when you're a positive and optimistic guy like you, and suddenly you find yourself, thinking negatively.
Yeah, it was
quite triggering.
Yeah, it was a shock. During that time in the hospital, because I was always so positive at the start, I thought I won't get to that point, because like there was all these counsellors and stuff that the nurses offered me support, like because of the traumatic situation, I guess, but. For me, I was like, I won't get there. And for me to get there, it was quite a shock and a realisation that, okay, we did arrive here.
But in hindsight, you can see it makes perfect sense though, right? Because fitness is such a big cornerstone of your life. It's actually like part of who you are as a person. And suddenly that's stripped away.
Yeah, and it will, as you say, it was suddenly. Like, if you look at it in January, I was slinging a barbell around, running around. And then in sort of Feb, March, May, I'm in the hospital. So yeah, it was suddenly just gone. Yeah,
and just not knowing when the end was in sight. Just due to the nature of heart transplants. So and that takes us to Sunday. Have I got the date right? Sunday, October 10?
October 4th.
Sunday, October 4, 2021, 5 a.m. You get a phone call.
Yeah.
Why is your phone not in flight mode or sleep mode?
That was the only time that it wasn't. I'm notorious for having my phone in flight mode, just so I don't get disturbed. But this time when I was waiting for the heart on the list, I was like, I'm going to have to sleep with my phone on loud, everything good to go.
Because the surgeon tells you, like, when we're ready to go, we're ready to go.
Yeah, pretty much. Obviously, the benefit, I lived in Devonport at the time, so I was only just over the bridge towards hospital. And it was quite funny, like my flatmate just started dating this guy, and the one night she's like, can I go stay at his house? I was like, yeah, I'll be fine, honestly, go stay. You've already done heaps for me. Go have a night with him. And then the one time that happens, I get the phone call in the morning, and she's got her phone on airplane mode. So I'm trying to ring her in the morning. Hey, can you drive me to hospital? The ticker's arrived, you know, like. And then
could you not just get an Uber?
Well, I could have, but me being me, her truck was right there, so I just jumped in the truck and just drove over. I was like, wow, I've got to get there.
Yeah, it serves her right when she ends up with a Wilson's parking bill of $800.
Yeah, exactly. So I was like, well, we just jumped in the truck.
Were you advised like not to drive at that point?
Yeah, definitely. Yeah, definitely not allowed to drive with the bags. It didn't help that her truck's a manual too, so I'm trying to like, push this thing with a weak chest at the moment. But yeah, the feeling of that phone call was quite, I guess, excitement really, like nerves, excitement, like fear. It all sort of just cycled. And then one of the initial things, like was grief, because someone's just passed away, obviously, in order for me to have this.
Yeah. What do you know? We'll get to the donor's story later on. But yeah, what are you told about the heart and the heart's origin? Nothing.
Yeah. So you pretty much get told like it's all I got told was it was a young male, similar age, and that was it. It is for security reasons and medical and confidence sort of stuff. But yeah, that's all that I got told.
Yeah, I was going to ask you about that. Like, there's a thing called survivor's guilt.
Yeah.
Yeah.
Yeah, definitely. And that guilt pretty much transferred into motivation, really. I was like, okay, like I've just been given the gift of a lifetime, pretty much the gift of life, really. How can I sort of honour that? And instead of having that guilt, survivor's guilt, and using that, it's okay, what's next? How do we achieve stuff that'll keep this person living just as much as me living, pretty much?
Fuck, you got a good mindset, eh? When was this, this sort of realisation? Was this in recovery?
In recovery, yeah.
Okay.
Yeah, definitely.
All right. Okay, so you drive the truck there.
Yeah.
So it's all a real whirlwind. What sort of time are you at hospital? Like 7 a.m., 6 a.m.?
Yeah, so I got it was about 6 a.m.
They don't fuck around, eh?
No, they don't. They don't. You're just straight in there.
Is it the earlier you can get there, the fresher the heart is and the better it is? Or
yeah, it's all quality. And they always say potential. So when they phoned up, they said, I think we've got a potential heart. And the reason why they say that is because you can get right up to the table, ready to go. Surgeon has a look at you, has a look at the heart. No, not happy. And boom, you're back home and you're waiting again. I know 3 people that I met during this whole journey. They got 2 missed calls, or like 2 calls that and on the 3rd go, they had their transplant. Well, I was just lucky to get the first one.
Yeah, it was all quite a fast turnaround for you, eh?
Yeah, definitely. So once I had that VAD surgery, I had to go to physio to get fit enough to go again under the knife because I couldn't just go from one surgery to the other. Body wouldn't have handled it. So I had the first surgery, went to physio, and then the cardiologist rang me up saying, hey, we're putting you back on the active list. We think your body will be able to handle it. And then I think, 10 days, 11 days later, that's when I got the phone call. So I was only on the list for 11 days. Yeah,
I mean, this is probably a little bit sort of woo-woo, but I wonder if like your positive thinking had any sort of impact on the positive outcomes. You know what I mean? There's obviously a lot of luck, or bad luck as it may be involved, but the way it happens so quickly and so successfully for you, I wonder if part of that reflects on your sort of energy and what you're putting out.
Yeah, I'd like to think so. But yeah.
So yes. So what are your last thoughts before going under for surgery?
Yeah, that whole thing's a blur. Like I remember arriving to hospital, and then one thing I remember because I was cracking up is that they have to strip all your body hair. So I've got my flatmate eventually arrived to hospital, shaving my arm, nurse shaving my arm, shaving this leg, shaving that leg, someone shaving my chest. It was like, what the heck? So I remember just sitting there like this, just cracking up.
Like your genitals and everything.
Yeah, everything. Everything's got to go. And I was just like, just quite invasive. But
some people pay good money for that.
Yeah, exactly.
Well, if that's your last thought, it's not a bad way to go.
Yeah. And then after that, I just remember sort of getting like taken to the surgery room. I remember looking at it, the table, with everything. And after that, blank. Really, it's just gone blank after that. So I don't know, what my thoughts were.
And it's a massive operation, eh? Like 11 hours.
Yeah.
How many staff in the room?
Oh, I don't know.
Like a dozen or something.
At least a dozen. I remember when I walked in, I counted about 10, and there was still more to come in because they were like, "Oh, we're just waiting on a few more people." And I was looking around, I was like, "A few more? Like, you've got half the bloody hospital in here now to me." But okay, but 11 hours is like
do you remember? Were you nervous or were you just like game on?
No, it's like game on. I just tried to think of that output. I was like, because at this time, for me, it was long. When I look at the timeline, it's not. But I was like, we're finally, going to get rid of these bags. Like, I was stoked. I was like, these bags can ride off pretty much. I was like, they're going to go. So I was stoked about that. And then I knew the future after this, it was just going to go up. So I was excited.
Was there like a chance that you could have died on the operating table?
100%. I don't know if there is a percentage on it. There's obviously heaps of factors. Not all surgeries take 11 hours too. They had troubles getting the motors and stuff out of my heart, like getting the old heart out with all the cords and stuff that it had in it. I know they clipped my lungs on the way out, so they had to repair that as well on that time. So a lot of factors happened.
Have you got a big scar or is it like
straight down the middle?
Really? Can you show us?
Yeah, for sure. So it starts up here, just goes straight down.
Oh, bro!
And then all these two scars are just from drains and everything. But straight down the middle.
Geez, so they've got the rib cage right open, eh?
Yeah. So funnily enough, I wanted to see how they did it. So. Yeah.
Did someone have a GoPro?
Yeah, I asked to record it actually, and they said, "Oh no, it's too long. Yeah, it'll just chew up your phone." And I was like, "Oh, okay." But I really wanted to see how they cut you open. So in ICU, once I was a little bit better, I asked the nurse to show me, and she's like, "Are you sure?" And I was like, "Yeah, I want to see it." So that she showed me a video on YouTube of just them cutting the skin. Then they used a bone saw, cut the bone, and then they used like this vice thing, and they just boom, crack you open. And I'm just sitting there watching. And, oh, wow, okay, that's what happened. And I was like, that's why I'm in so much pain.
Yeah, and so after the surgery, you're in a coma for like 5 days.
Yeah, correct.
What do you remember from that time? Anything at all?
Nothing. No? Absolutely nothing.
No trippy dreams or any?
Nah, not.
No thoughts at all? So you're just like dead, basically?
Yeah, pretty much. Like, one of the guys that was just after me, he was 24 hours out of there after surgery. And I thought, I'll just sleep for like 5 days or just knocked out and just had no clue what was going on around me.
Yeah, I've got a photo. Is that?
Yeah.
Is that time?
Yeah, that is that time.
So you've got no record. Did you know that photo was being taken or?
No, nothing.
That must have been. So who was there? Your parents there? Or?
Yeah. Parents were there. They'd come in like every day, check on me and just see. It's quite cool. They give you like a log, almost like a journal, and the nurses fill it out. So they'll be like, day one, I looked after you from this period. This is what was happening. This is what we did. And then they documented the whole thing, which was quite cool to look back on because obviously I'm asleep during this time, so I have no idea. And they're putting their notes in. But 5 days, I was like, that's a long time.
I can't imagine how stressful that was for your parents.
Yeah, unreal. I don't have kids at the moment, but I could just imagine that would be intense for them during that, especially being out for so long and just having to put pretty much all your faith in the doctors to let them do their job and let the body do what it does.
So it's like an induced coma. So they're keeping you deliberately drugged just to wait to see if the heart settles. Or?
Yeah. So I think there were some complications, and they weren't ready to pull me out yet. Unsure what those were, what the complications were, or why. But yeah, they were just waiting for their time to wake me up, pretty much.
God, Your parents must have spent a fortune at muffin break.
Yeah, exactly.
So they
Goes through the roof.
Wow. And then, unbelievable. And so 5 days after a coma, any recollections of that time?
No, when I first sort of woke up, there's patches that I remember of waking up and seeing like this nurse look after me and like seeing the room, and the room's like warping too, because obviously drugged up as anything. Yeah, everything. So I remember the roof moving and all this sort of stuff. Like I remember random people coming in to obviously maybe check on their person that they were seeing. I remember that coming through. I don't really remember the room shape or anything. Just remember sort of seeing over there someone's gone to see their mate. I just remember, like some machines. I don't even know if they were actually there, if I was hallucinating them or not. But I was like, this is crazy. And then I was in and out of that sort of space, just boom, drift back off, and then wake up, and then just hear noises. I remember like noises. I remember hearing stuff, and it's just mainly machines, beeps and noises, and yeah, it was weird. It was weird.
When did you start to come out of that haze?
Probably, when did I come out of that? Once they took the breathing tube out, that's when I remember being more coherent. I remember that thing was giving me ball aches. It was pissing me right off, that thing. Just shoved down my throat like.
Oh, is that one of the ventilator things?
Yeah. It's like this big breathing tube. And they pulled it out too early, and then my lung collapsed. So then I remember being on a sleep mask. I remember like fully trying to breathe. Like it was just weird. Like I remember like kicking my whole body just to try and get a breath in, and then breathing out. I know that was a scary time for Mum. I remember Mum watching, because obviously I'm struggling to breathe here. This big mask is pumping oxygen in. And then they had to put me back under and put the breathing tube back in. And at that point, I was not keen. I remember looking at the doctor like, no, like just not a chance you're putting that thing back down my throat. And he's like, look, we have to. And I was like, far out. I was not keen at all. But yeah, that went back down. And then the second time that came back up, then I was good to go. But yeah, I remember that thing causing me pain.
Yeah, and what about the recovery? Long and slow?
Yeah.
How long were you in hospital for?
So I had the surgery October 4th. I then went to like the rehab spot in Harvey Towers, which is just in Green Lane. It's like a transitions period, so all transplants go there once they come out of hospital to then transition back into life. So you start cooking, start cleaning, see what your body's like. You're right by the nurses, so if anything does happen, you're straight back there. So I was there for 4 weeks. I think I was in hospital after surgery for 3. So I had a week in ICU, a week in the next ward, and then a week in the transition ward sort of thing, and then back to Harvey Towers. I remember 3 weeks, and I remember that recovery, like taking my first steps or getting sit up for the first time, sit up out of the bed, and all like they told me to do was move my feet like this. And I remember I've never had to think about moving my feet. I was like, okay, left, right, and just trying to do that. And that was crazy. And then when they set me up and we got up out of bed and went for like pretty much my first walk, I remember that. And I remember like, normally you just walk like that. My legs were coming in like this. So I was like, what the heck is going on here? And like in my mind, I'm like, walk like this. And then the legs are just coming across. And I just no muscle really. Everything was just gone. So I just had no strength. Just leaning on this thing, trying to like shuffle my feet, trying to tell my like feet walk like this. But yeah, that was definitely weird. Just
from being inactive for so long.
Yeah. So I went into hospital at 86 kgs. And then after surgery, I was 64. So there's 22 kgs. I've never been a big dude too, overweight. So it was just mainly all muscle mass and just body's just gone, just had nothing.
And your mental health around that time? Obviously, like you're weak and it's frustrating and it's hard, but you do have a new heart, so things are looking good.
Yeah, things are looking good. When I did that first walk, I was like, hallelujah, like we can walk again, we're up. And that I remember that after that first walk, that's when things sort of really started to take off in recovery. I think the body just started to move again. Muscles were starting to be active. And then from there, it just kept going and was more walks. I was just demanding the nurses to take me on a walk like I was a dog, almost like, take me on a walk, let's go. Because you had to like plug in and all these machines and everything before you could go. You couldn't just get up and go. But yeah, I just knew if I keep moving, like the body's just going to naturally start to kick into gear and start to heal.
Yeah, I saw a photo of you online. And you've got like a stroller thing, and there's a lot of paraphernalia. There's a lot going on with it.
Yeah, definitely.
So the logistics of moving in those early days was quite intense.
Yeah, and there's about 3 nurses that would have to come with me. One would have to watch the monitor, watch my heart rate. The other one would have to watch the oxygen and all this stuff. Make sure all my cords are still stay attached to me. Everything. It was crazy when I look back on it, just to think like just going for a walk. You're pretty much taking like a whole factory with you almost. It's crazy.
And then when are you allowed to go home?
Pretty much once, I guess, I don't know what the criteria was for me to get into the next wards, but it was just pretty much strength and get better. It was all around strength and fitness, about can you actually do all the stuff that you need to do at home before, because if they release you early, then you're just going to come straight back if they don't know that you're physically fit and able to do everything. So I think that's what that transition period's all about. Can you make your bed? Can you cook? Can you shower yourself? Can you do all those? Once, and then the physio, it's going to physio every day with them, starting with like just the air squat. I remember having 1 kg dumbbells and just couldn't push them up. And before that time, I remember looking at 1 kg dumbbells in the gym going, what's the point of having these? Like, why do we have these here? There's just bloody baby weights. And then 8 months later, I'm sitting there like this trying to push them. I remember looking back on it going, that's why we have them.
Shout out to all the other people like myself who do their curls with 1 kilo dumbbells. No shame.
Yeah,
Any
exactly.
movement's better than no movement.
Yeah, actual.
Wow, that's amazing. Yeah. Yeah, I remember reading the Lance Armstrong, the cyclist.
Yeah.
I remember reading his book. 'Cause he had testicular cancer and was given like a 2% chance of survival. And then in his book, he talks about like his first bike ride being back in recovery, and he was going up a slight incline, and he was off the saddle pedaling hard. Then some old lady who went steaming past him on her bike. So I guess it's the same sort of thing. Like it's just almost like control out delete. You're back to ground zero.
Yeah, and I've heard it heaps in the fitness industry. Like, I've had a week off, I've got to start at square one. And like in my head, I'm like, you have no idea what square one is. Like,
you've been there.
Yeah, had to go legit to square one, learning how to walk, how to lift the weight, how to do an air squat, could barely squat, all this sort of stuff. So it was proper, square one for myself.
And did it feel, this is probably a weird question, but like having another person's heart in your chest, did it feel any different?
Yeah, I've been asked that a bit around some people. The nurses telling me some people like adopt habits from that person.
Hey.
Yeah, spooky sort of stuff. And they said the patients don't realise it. It's their friend group that realises it. And they start to go, like he or she wasn't doing that before. I haven't had anything like that personally. I don't actually notice really the feeling of someone else's heart because they take all the nerves around, so you don't actually feel it anyway because you can't reattach nerves, so all the nerves are gone anyway. So when you go for a workout or a run or whatever and you can feel your heart beating, I can't actually feel that because all the nerves are gone. So I just know the symptoms are more just like out of breath sort of stuff. But yeah, I haven't really felt that. Mentally, I know that there's someone. Physically, like there's nothing. In that sort of realm that's happened. And
what are the chances of rejection? Is that something that if you make it through the danger period, like the first 30 days, 50 days or whatever, then...
Yeah, 2 years.
2 years?
First 2 years.
So you're out of the...
Yeah, so I'm out of that danger zone. Through that period, I did have some rejection. They call it like a 1R, 2R, 3R. 1R is like, you'll definitely know about it. 2R, 3R. 3R's real mild rejection, 2R sort of medium. I had a couple 3Rs and 2Rs as well. Still didn't know the symptoms, still didn't feel anything. It was just when I was going for my regular testing, they were picking it up with regular biopsies. And And now, because of that, I'm still on this drug called prednisone. Normally you'll phase off it, but I'm still on it just because of the early stages of rejection that I had. But again, I didn't feel any rejection or whatever. It was just what they were picking up in the tissue samples when they were taking them.
Yeah, what sort of pills are you on? And are you on them for life?
Yeah, I'm on the pills for life. So I've got tacrolimus, mycophenolate, prednisone, aspirin. What else is there? Pravastatin. Pretty much mainly rejection, anti-rejection, bit of blood pressure, and antibiotic. Pretty much is pretty much what the big cocktail is.
So how many a day?
So there's about 5 in the morning, 3 at night.
Oh, okay. Oh, that's not as bad as what I thought. I imagine it was like a massive.
It was when I first came out of hospital. So I was on about 16 in the morning, about 8 at night. And I remember my mates jokingly saying, "We're going to buy you one of those like old man Monday to Sunday,
Monday, Tuesday,
yeah, to thing."
Kiwis warehouse special.
So I actually had one, but I had too many drugs to put in them. They didn't even fit. So I was like, "Fuck, I can't even use this." Yeah.
Oh god, that's funny. And you must have bounced back pretty quickly because this is where the story sort of pivots and. Oh, well, like it's a beautiful way, but it's a heartbreaking way as well. So 7 months after your heart transplant, you're doing a half marathon.
Yeah.
Yeah. Did you have to get clearance from cardiologists and things like that?
I think I should have, but I didn't.
Because you know, on the one hand, you'd think working the heart and using it is a good thing to do, but on the other hand, I suppose there becomes a point where it's diminishing returns in terms of strenuous exercise.
Yeah, I think...
So you went rogue?
Yeah, a little bit. I had a tendency to do that with my doctors around health and fitness.
There's no way, if you fuck this up, there's no way they're giving you another heart.
Yeah, exactly. So I was just like, I couldn't go back to CrossFit. They said it's too intense, heart rate's going to shoot up. So I was like, what else is out there? Like, there's got to be something out there. One of my mates is from Hawke's Bay. So he thought up the idea and he's like, do you want to have a crack? And I was like, it's pretty early, right? But during the sort of small little training that I did, it was all just about moving as slow and the heart rate not really climbing at all. So I knew during my pre-runs, I never really crept up to a high heart rate. So I was like, okay, this will be fine in my uneducated view. I was like, I'll be fine. Like, just to keep it nice and steady and just slow. The goal was never to really PB, obviously, and to sprint away.
Low and slow, just get it done.
Yeah, just get it done. If I needed to walk, I'll walk. It was just about finishing, really. And the boys that we went down with, they had their own goals that they did and achieved. So, yeah, we all crushed it that day in our own way. But yeah, I remember, I think my pace was like average 8-minute Ks. So it was real slow. And it's funny you brought up that Armstrong, because I remember running and I remember this old man walking past me. And I was like, you're kidding. And I was like, I'm slowly running and he's just power walking right past me. This is about the 16K mark. And I was like, wow, this is a bit of humble pie.
But still, yeah, you must have been immensely proud though, just getting it done.
Yeah, I was stoked. I was never really a strong runner before this. So that was the longest I've ever run. And to do it 7 months after transplant, I was like, okay. It was like a we're back sort of moment. I was like, okay, yeah, we're good to go now. We're back. What can we achieve next? And then I felt me at that point. I was like, I'm good.
It's an alarmingly quick turnaround, eh?
Yeah.
From a heart transplant to taking part in a half marathon 7 months later. It's crazy.
Yeah. I look back on it now going, what the heck? Well,
pump the brakes, mate.
Yeah.
Slow down.
Yeah. I did tell my cardiologist and they were like, okay, dial back. And I was like, oh, yep. Yeah,
but the amazing serendipitous thing about this is, yes, you end up getting some media coverage about doing the half marathon.
Yeah.
So Stuff wrote a piece or...
Yeah. So I remember when I was filling in the application form to do it, or registering, I was like, I better put it down. Like, better put down that I've had a transplant in case something happens, then the team are aware of it. So I put it down in the form under the medical conditions, and then that's when who who are they? The owners that run the Hawke's Bay reached out wanting to do an article, and then New Zealand Herald also reached out wanting to do an article. And at that time, I think it was Stuff. I've never really sort of told my story, never really thought much of it. Just thought, like, I'm on this journey, I want to get better, I want to run and achieve this goal. And that was sort of the start where I was like, okay, let's do it. Like, why not? Why not get it out there?
How are you? Were you nervous about that?
Yeah, I was a little bit.
Yeah.
And I didn't know, because it was sort of the first time I've told like all my mates the story and stuff, but, you know, that's just easy, just sitting in a lounge. And then telling the media, I was like, okay, is this going to be something that they want to know, or like, how was it? And it was just, yeah, it's different. But it was good to get it off my chest, sort of tell more people. The more I told it, the more I was, I guess, more proud of what I've done. And not being too shy about being proud. Like, us males, we're always sort of underselling ourselves. And then the more I told that story, I was like, actually, no, I'm pretty stoked that I could do that. I was chuffed. Yeah,
you should be proud of it. It is a male thing. Is it also like a Māori culture thing that you're not allowed to, like,
I would
be like braggy, or?
Yeah, I would say like, yeah, not allowed to, but yeah, definitely, like, we're just so, quiet and just not braggy.
Yeah, I've got some Pacifica mates, and they're always like, humble yourself.
Yeah.
But sometimes you got to celebrate these successes. Like, this is a massive win.
Yeah, it was a massive win, and I was stoked. But yeah, it was good to get it off my chest and to celebrate it, and actually, realise that the body can achieve that.
Yeah, and had you not been open to doing this media, chances are you would have never come across Nikki and Spencer.
Yeah, correct.
Josh's parents. Josh Heath. Actually, I've got a photo of Josh here. What can you tell us about Josh?
Yeah,
a man you never met, young man you never met.
Yeah, a young man that I never met. When I met his mum and dad, that they told me that he was starting to get into his health and fitness and get into the gym and wanted to be bigger. And his mum and dad sort of joked, well, now he is a little bit bigger, because I was a little bit bigger than Josh at the time. So
you can't calm down. You're still lifting 1K dumbbells.
Yeah, I know. He sort of low-key got his wish of getting bigger in a weird, funny way. But yeah, it's quite like that moment that she reached out was all because of that Herald, that article. The parents were just reading it. The dad read it, just read right through it. And then I think the mum read it and sort of was like, hang on. Because they got told sort of similar what I got told. A young man, similar of age, Josh was donated to. And that's all they had to go off. And then they read that article about the half marathon, seen the date. Josh passed away October 3rd. I got the transplant October 4th. Young male, similar age. So she tracked me down on Facebook and then sent me a message. She said she wrote it multiple times, hands are shaking while she was writing it. And then, sent it to me. This is about 3-ish p.m., I think. I remember being at work, just sitting there, get this message request, boom, open it, from Nikki, pretty much saying the first line from her, hey, I don't know how to say this, but I think you've got my son's heart. And then just boom, like the emotion that I had just sitting there, I was like, whoa, crazy.
Yeah, how do you react to that?
Yeah, it took me a while. I was stoked, though, that she did reach out, because this whole time I've always wanted to thank, like, obviously this family, and, like, what I went through was tough, but in my eyes, what they've gone through and still going through is way more tough than a transplant. Like, to lose a son of only 19 years old, like, that is pain that will be hard to heal from, whereas the transplant pain and all that pain that I went from, like, I guess healed and, like, good to go. So yeah, I was stoked that I could finally, that she did reach out and that I could connect with that family. And it was just extra motivation to, I guess, appreciate the gift that I've got and do everything for Josh and learn about him, about what he liked in his life and what he was doing. He seemed like he had a good bunch of mates and everything.
Yeah. From what you've learned about him in retrospect, like, who was Josh? Who's Josh Heath?
Yeah, he was a young fella in Rotorua. Was into his gymming. Was apprentice for his old man. So he just started his apprenticeship. What's funny is his mum asked me if I like drinking long whites because that's what Josh was into drinking.
Down the young New Zealanders. What are the chances?
Yeah, long whites. And I said, I do like a long white actually. So, cheers, Josh.
Did you like long whites beforehand? Or?
Yeah, I did actually, though. Okay. So it sort of wasn't just him. But that
would be weird if suddenly you became like a...
Yeah, exactly. It could have been one of those moments. But yeah, and that's pretty much what I learned about Josh. Cool. Like, it seemed like he had a good life. So it was a shame that I got taken away from him so young. I guess that was a moment, like unreal family, like cool ass family. So yeah, just honestly, just extra motivation just to keep going.
Yeah, from what I can gather, he was a passenger in a car with a mate who was had been drinking and smoking some weed, and it was a car accident, and they'd discussed earlier about him being like a donor on his driver's license.
Yeah.
But even if you tick the donor box, if you're on life support, the family can override it at the last minute.
Yeah, correct. So New Zealand, still, even if we do tick it again, as you said, the family can just go nah. And that still happens in New Zealand. I don't think all countries are the same, but yeah. And like the list, I remember the mum telling me the list that they give you is like surprising of how much you can actually donate from your body. Like there was stuff like eyes and everything. And like Nikki's like, you can't take my son's eyes. Like you ain't taking my boy's eyes. But yeah, you can have this, and this, and this, which is, I guess, a huge decision. At that time,
100%.
I couldn't, think about what you'd go through during that time of grief, and then being told, like, "Hey, can this happen?" And where your mindset would be like, "Okay, if I give this, potential other people will be saved," and like having that, I guess, that mindset, be able to save others.
Yeah. Do you know much about his other organs and where they ended up?
I know his lungs went to this, he was in his mid-30s, late 30s, because he was at the hospital when I was there. So we both went through our surgeries at similar times, obviously for obvious reasons. And then I remember the part of the liver, I think, went to a young, like newborn sort of in Melbourne, I think. And I've met Troy, who had the lungs. He unfortunately passed away about a year and a half ago, and that was his third lung transplant. He had, I think it's just fibrosis or whatever it was, but yeah, those are pretty much what I know, that he still managed to save his life for a little bit and making a living, and obviously to donate to a young baby in Melbourne, where that's just gonna, and then me as well.
Yeah.
So yeah, save some lives.
Yeah, what about when you first met Nikki and Spencer? Because you've caught up with Josh's parents again. You've caught up with them a couple of times, right?
Yeah, correct.
How was that? Like the first time so did you drive to their house?
Yeah. So I drove down to Rotorua. Yeah, I was nervous. I knew they'd be nervous too.
It's a big deal for everyone involved. It's wonderful, but it's also fairly shitty circumstances.
Yeah, exactly. And I think both of us, we didn't really know what to do, like, because there's no agenda, right? So like, it was sort of just going down there and meeting. Had a nice little lunch with them, and I sort of just tried to, I guess, tell them about myself, sort of try and lead the conversation a little bit. But yeah, we were both sort of like, what do we do? It was quite, I guess, not eerie, but yeah, emotion was through the roof. For me, I was stoked when I remember driving back, just like wrapped that I've met them. A bit of closure. I hope it was a bit of closure for them and myself, just like, okay, and just pretty much got a new family now as well. But yeah, that was a cool moment. Yeah, it was good. I was glad I went down there.
That's cool. Yeah. And then you took part in the Invictus Games. So for anyone that's not familiar with the Invictus Games, who's allowed to compete in them? Yeah,
so the Invictus Game is for past or present serving military members that have had an injury or illness happen to them during serving, and then they get a chance to compete in these games that Prince Harry, or Duke Harry, I think he is now, that started up. So that's been going for 10 years now, and it's every 2 years they compete. So yeah, militaries from all over the world go over there and compete in these sort of, I guess, Olympic sort of style of events. Yeah, and the illnesses and injuries over there is like everything and anything, pretty much. Some crazy stories that I ran into over there. But an unreal opportunity when it came up, I was definitely keen for.
Yeah, there were 20 Kiwi athletes that took part. Any sort of standout stories or anything that inspired you?
Yeah, there was this other Kiwi athlete that was in the SAS during his serving, and he's so casual, and he just told me his story. He's like, I just got shot a couple of times, rolled down the hill, jumped in my truck, and then drove back to camp. And I was like, wait, what? Like, you what? And he's like, I was just on a mission, got shot, rolled down the hill, smoked my whole spine, my whole body's just pretty much full of metal now. And I drove back. I was like, crazy. Like, and for someone like that, that's been through that and is still out here trying to, I guess, better himself and partake and still be active, those are sort of the stories that sort of stood out for me. Whereas these people had these major sort of, I guess, life-changing events and still trying to be better. Like, those are the people that I want to surround myself with. Just people trying to push the limits, whether you've got an able body or not able body. Either way, as long as you're still pushing your body's limits and still using your body for what it can be, then it's happy days. Yeah,
because there's that saying, which everyone knows, like, comparison is the theft of joy. But actually, if you compare down, you don't have to look far to see someone that's, got it a lot tougher than what you do, right?
Yeah, exactly. And he was telling me that, like, what I've been through is worse than him, and I'm telling him, no, you
win. You win as the SAS guy.
Yeah.
They're built differently. They
are.
Guys.
It's just another day at the office for them.
Did you meet Prince Harry? Was he there?
Yeah, I did. That was quite funny. One of our New Zealand media lady came up and was like, I need you to do something. And I was like, okay, what's that? Because you're going to go meet the Prince. And I was like, crazy, okay. So it was a part, like, he was just going around the stadium, then I had to sit there pretending I was drawing on something, and then he'd stop me and we'd have a quick yarn. And that was quite cool. I think the thing I liked about him was when I was talking to him, I could just tell he was actively listening instead of just listening because of the cameras were all there. Like, he actively wanted to know about Josh and about my sort of story. It was real quick. But yeah, I think it was genuine what I got, the feeling that I got from him. He was just all eyes and just zoned in on my story. So that was quite cool to meet him and realise that he actually is just human, like the rest of us.
Yeah. Oh, yeah, we all are. Yeah. Everyone shits.
Yeah, exactly.
And you ran with a T-shirt with a picture of Josh on the front.
Yeah.
Where did the idea come to do that?
So that came from the Hawke's Bay Half Marathon. One of my mates is in the graphic design sort of business. So I was like, I wanted to run with a shirt with Josh on it, carry him through that 21 Ks. So therefore he ran it, I ran it, his family ran it. And that's where the T-shirt came from. And then from there, it was designed for me to just keep any sort of achievement that I did would always be with that T-shirt. So I wanted to take him overseas as well.
That's so cool.
Yeah.
That yeah. I kind of, like, for Nikki and Spencer, like Josh's parents, like, I can't imagine what that means to them, you know?
Yeah, I was cool. I did up a few more T-shirts to take down to them as well, so they could have some. But yeah, that was a cool moment running with him.
Yeah. Oh, that's neat. What would you like people to know about organ donation? I feel like it's something we just don't even know about, eh? It's not even talked about.
Yeah, I guess it's not talked about, and especially in Te Ao Māori culture, that we are brought up with what you are given with. You give back to Papatuanuku, so you give back to the earth. And I guess during that time, like, a lot of staunch sort of Te Ao Māori people that are in my life changed their license to donate because they realised that, yeah, they acknowledge that sort of side, but then the acknowledgement of like new sort of principles and like that what the bodies can like what can happen if you donate. We didn't know that way back in the day, and then now like you can save so many lives and how changing it is. So I guess yeah, to sort of think positive, like in my eyes, like you don't need it anymore. Like someone else will use it, hopefully to the best of their abilities to treasure that gift. So yeah, I'd always encourage people to be donors, but encourage is probably all I can do. And then if they want to make that decision, they make that decision.
Were there any like whānau or elders in particular, I guess, that were like against it? Thought you shouldn't be getting the transplant, or?
No, I was quite lucky in that I never got into that. This would be, yeah, it could go there. I could see it going that way. I was just lucky that it didn't have to have those conversations or go down that way.
Yeah, and what's your tattoo journey? Did you have these before, or have they come post
So everything's before, except for this one on my hand. And the idea behind this one, why I wanted it to sort of start there, is that I feel like I just got like pushed over, and then landed on my hands, and then ever since there, it sort of just absorbed new life, and we're coming back, and we just get back up. And that's sort of the story that we told through that moko piece done by my ink-out. Papakura, he was real good with that.
And are you done, or is the story continuing?
Yeah, so the story will continue. So that's pretty much like the diagnosis sort of piece. Then we're going to do like a small symbol here to acknowledge the transplant, and then the recovery piece will go down this arm. And that's pretty much how the story will get told, even though you're not meant to get tattoos post-transplant. But
you're not? Oh, my God.
Yeah. But,
well, you're not supposed to run a half marathon 7 months afterwards, so you may as well just continue breaking rules.
Yeah, so I slightly bend the rules when I can.
Why are you not supposed to get ink?
It's all about like infection and stuff. Because you're on immunosuppressants, the chances of infection are a lot higher. So for any reason, if this goes bad, then your body might not be able to process it as efficiently as your body would. So they just give you the caution. But I let my tattooist know about it. So everything was cleaned and everything. So, yeah, in my eyes, it was fine. But, yeah, there's still a chance.
Oh, that's awesome. What are some of the most valuable life lessons you've learned through this experience?
Cool. Yeah, I'd say pretty much one of them was just to say yes to everything. And, like, it's cliche, but, yeah, life's just too short. I realised that firsthand. Like, I've thrown away that sentence before, the heart, like, life's too short, might as well have a crack. But now I understand that life is too short, and you should take opportunities that pop up. And that's pretty much what I've been doing. That's pretty much the main lesson. And then we were just having a conversation the other day, actually, with one of my mates around getting checked. Like, males don't get checked for anything. We just crack on with life and just wait. I mean, I was sick for ages and I still wouldn't go and get checked. So I think that's another message that I sort of want to try and get out there. It doesn't matter if you're fit and healthy, just get checked, like, for anything. You never know. But yeah, those probably the two sort of lessons.
That's a good one. Yeah, early detection can just save you a world of...
Oh, it's crazy.
A world of pain, a world of headaches, a world of heartbreak. Like, it's just... Yeah, get regular checkups. Just do it. Get everything tested.
Yeah.
You're actually just being an idiot. You're not being a hero by not getting it done.
Yeah, we're too stubborn.
Yeah. If you could go back and give advice to yourself before the transplant, what would you say?
What would I say? Before the transplant. So you meaning like I've already been diagnosed and I've been told that I'm going to get a transplant, or...
I don't know, mate. It's your question.
Yeah.
Interpret it any way you want. I suppose if it was real early on, you could be like, go to the fucking doctor.
Yeah.
It's not normal that you can't walk up the stairs.
That would definitely be like my advice.
Yeah.
Like, you're not bulletproof. Realise that. And then I guess my second advice was probably just let people help you. I'm a shocker I still am now actually, of not letting people help me. Like, I'm trying to do everything on my own. And that was a little bit of a wake-up call, realising that you do need help. Like, I've always been stubborn enough to say, no, I'll get it done. and then I couldn't even go to the toilet by myself. Like I couldn't do that. So I was like, okay, just let people help. If they want to help, they will. If they don't, they won't offer it. So that's another sort of thing that I'd probably give myself advice, was just let people help.
And how are you now with like tough conversations and vulnerability? Like if you need help, are you okay to ask for it, or still no? Still work to do there?
Still work to do, definitely still work to do. But I think I'm just aware of it. Like I'm actually aware of it now that I am that stubborn. I know it racks up my flatmate a lot. But yeah, it's definitely more aware of it. And I know it's a work on that I'll get better at.
What has this experience taught you about resilience and gratitude?
Resilience, I think what it's taught to me, being in the military, like we get taught about resilience and going through tough times, and knowing that the body and the mind can do so much. And then going through this, pretty much living it, realizing like if your mental resilience is poor, like you're going to go down. Like it's easy just to sit there and, as I say, think negatively, but if we dwell on the positive and have that mental resilience, your journey is actually a lot better. I look back on my journey and I'm like, my journey wasn't actually that bad for a traumatic experience, and that was pretty much because of the mental resilience to want to go, want to get better, get back on that road. So it's only going to benefit yourself. It's easier to say than do, but yeah, it's a challenge, right?
Yeah, how do you stay positive and motivated on tough days?
For me, it's that I'm alive. Pretty much, I think back to when, like, if I snooze my alarm for training or whatever, I think, like, I sometimes kick myself and I realise, hang on, like, you were begging to train, like, a few years ago. Like, you were begging to be able to walk. Like, now you can walk and you can go to the gym. Go. Like, get up and go. This is a time in your life where you are able to train. So get up and do it, because 3 years ago I couldn't and I was begging to train. So I guess that's sort of the moments that I think about, and that just gives me extra motivation to get up and go do it.
Yeah, and I suppose you only need to think about like this young kid here who would give anything for the opportunity to go for one more run or one more sesh.
Yeah, exactly. And I do catch myself being lazy every now and then. That's sort of the human side coming out at me, and then I dig myself out of that and be like, get up, go. Like, this man, as you say, can't. So we better go and do it.
And what's next for you? Like in the next 2 years, 5 years, 10 years, what goals or dreams are you pursuing now?
Yeah, so once we just finished the Queenstown Marathon a few weeks ago, that was another goal. Once we finished that half, the boys were keen to tick off the full, and that was an experience in itself. And we talked with that group during this full that we need to do this every year and celebrate that we can. It took for me to have a heart transplant to get the brothers together to be able to push the body, and now we do it every year. So we're looking at stuff next year. We're looking at maybe doing a triathlon, like a group, either Iron Māori or Iron Man. We're looking at, you got to train for everything, and on the day, pull out your either swim.
Oh, the discipline.
The discipline.
Oh, wow.
So we might...
like a lucky dip try.
Yeah, like a lucky dip. So we'll all turn up and you do a team one or something, and you pull out, and then away we go, just to sort of keep things interesting. But yeah, definitely, that's probably the next one, something like that. I'd probably, like the marathon broke me. Like that one was tough.
How long did it take you?
5 hours and 40 minutes. So I was there slogging away, walking, running, hobbling. So that was another probably mental resilience piece that I realised I was in a dark place, different dark place, but yeah, hurt locker place. And that had to rely on Josh a lot to get me through that one actually. So yeah, sort of want to continue to push that body and do stuff like that. That brings me back to that space and keep pushing forward.
Well, you're inspirational, mate. It's been really cool sitting down with you today.
Yeah, it's been cool just to tell the story, I guess.
Yeah, it's a lot to reflect on.
Yeah, it is.
And I get the feeling you're such a growth mindset person that you don't spend a lot of time sitting and reflecting. You're just constantly looking for what's next.
Yeah, correct. That has been good about this podcast, is just having that time to sit I guess you reflect back on those, like some of the questions he asked me, like, and taking me back, like actually having to think about those feelings, which was quite cool. As you say, I don't do that often, and I should.
Well, it's cool. Yeah, you're an impressive young New Zealander, and I'm glad the outcome for you has been positive, and I can't wait to see what you do next. It seems like one of the big work-ons is you got a great group of mates, and you do some cool shit. Just need to work on that conversation piece a little bit.
Yeah, 100%, definitely.
Mate, it's so hard though. As long as you're aware of it though, and it's a work in progress.
Yeah.
Onwards and upwards. Hey,
Onwards and upwards.
Yeah, this has been amazing, mate. Jack Church. Inspirational New Zealander. Thanks so much, mate, for coming on the podcast.
Thank you very much for having me. It's been awesome. Loved it.